I believe that healthcare is a service that should be provided by the government. Now, before you call me anti-capitalist or any less right-wing, let me be clear. I am a free market capitalist to my core. I believe in competition, innovation, and the idea that businesses providing the best products at the best price should succeed. Capitalism has transformed America into the most powerful nation in human history, created technological miracles, and driven unprecedented prosperity. But even proud capitalists must acknowledge a simple truth. Not every essential service thrives under a purely profit-driven model. That is why we do not privatize public schools, fire departments, police departments, highways, libraries, sewage systems, emergency services, and more. We recognize that certain pillars of society must be guaranteed, not commodified. These are not fringe socialist experiments. They're mainstream, common-sense American institutions. So why is healthcare treated differently? Why should the price of your life or your child's health depend on which private company feels like covering you this year? The truth is, healthcare is not a competitive market. A handful of insurance giants carve up regional markets, coordinate prices, and lobby Congress with billions of dollars, not to improve care, but to protect profits and keep alternatives out of reach. This is not capitalism. It is cartel behavior with government protection. As conservatives, let's look at our values. We believe in equality under the law, in strong families and communities, and in a government that serves the people, not corporate interests. If fire protection, policing, and public education are fundamental services, why should life-saving medical care be treated differently? Healthcare is infrastructure, national security, and the foundation of a productive, self-reliant society. A government-provided healthcare baseline does not eliminate capitalism. Private insurance and specialized care could still thrive, competing on upgrades, luxury services, and innovations, just as private schools coexist with public schools, or private security firms operate alongside police. A public option restores competition rather than replacing it, preventing giant corporations from locking consumers into predatory systems. So how would the government pay for this? The reality is, we already do. Every time we visit a doctor, fill a prescription, or enter an emergency room, taxpayer money is already flowing into the system through Medicare, Medicaid, CHIP, the VA, and subsidies for private insurance. In other words, the funds exist. They are just scattered across a patchwork of programs, insurers, and administrative fees. Consolidating this money under a single payer system would not create a new $3 trillion burden. It would simplify the system, cut bureaucracy, and negotiate prices to make care more affordable and accessible. Currently, federal healthcare spending is about $1.9 trillion per year, meaning every American already contributes roughly $5,700 annually through their taxes. The total U.S. healthcare spending is even higher, about $4.3 trillion in 2021. Estimates for a universal system range from $3.2 to $3.6 trillion. Even in the worst case, a universal healthcare would save roughly $600 billion, and in a best case, $1 trillion. There is simply no scenario in which providing healthcare for all Americans would cost more than we already spend. These savings could provide better access for 80 million uninsured or underinsured Americans, making the system both financially and morally responsible. And don't forget, this would mean life-saving treatments could be accessible to everyone at no cost. Right now, medications for conditions like ADHD or diabetes are often priced far beyond what people can afford, driven by the high demand and profit motives of private companies. By reforming the FDA, the focus could shift toward fostering genuine innovation, developing new therapies, and rigorously evaluating the effectiveness of existing ones. A government-led approach would create strong incentives to invest in research and development, driving breakthroughs that save lives while also reducing overall costs. Today, private companies often prioritize profits over cures, benefiting from ongoing illness rather than seeking lasting solutions. But imagine if the party in power were the one to deliver a true cure. Both the political impact and humanitarian impact would be monumental. This is not just about policy, it's about redefining the incentives in medicine to put people's health first. Universal healthcare is not an attack on capitalism. It's a recognition that some services are too essential to leave entirely to profit. It's common sense, good governance, and patriotic stewardship. We can maintain a thriving free market while ensuring that no American is forced to choose between life-saving care and financial ruin. That is how a strong, fair, and prosperous society takes care of its people. It's time we follow suit.